Hi, my name's Erin Cameron, and I'm an assistant professor at the Northern Ontario School of Medicine in the Human Sciences Division. I'm also the chair of MERLIN, which stands for the Medical Education Research Lab in the North, which is all about advancing and supporting medical education research at NASM. Today I'm going to be presenting the results from a research study that was a collaborative study between NASM, CRANER, which stands for the Center for Rural and Northern Health Research, and MERLIN. And the title of our presentation today is Exploring the Educational Impacts of NASM, Graduates' Stories of Curriculum and Community. I'd like to begin by acknowledging the research team that was involved in the study. It was led by Dr. Wayne Worry from the University of Minnesota Medical School in Duluth. I was a co-investigator on the study. It was also supported by research assistants Holly Flemming and Hassa Siddiqui from Merlin, and others involved in the study were Jill Sherman, and the NASM advisory team consisted of Dr. Roger Strasser and Dr. Catherine Chorvin. I'd also like just to thank you for listening and taking the time out of your schedule to listen to this presentation today. And if you have any further questions or want to learn more about Merlin, I'm happy to connect with you, and my contact details will be at the end of the presentation. So while many of you will be familiar with NASM, there might be some of you that are less familiar. So we wanted to contextualize NASM for you. So it was established in 2005 with a social accountability mandate to serve Northern Ontario. Really, the entire geography of Northern Ontario is the campus of NASM. Unique features of the medical school, is that it's affiliated to two universities, Lakehead University and Laurentian University. It's also affiliated to two academic health science centers, HSN, Health Sciences North in Sudbury, and the Thunder Bay Regional Health Sciences Center. It uses a distributed community engaged learning model, which is all about learning in and from the north and across Northern Ontario. And it has some very important relationship and collaborative agreements with 43 First Nation and Métis communities, as well as 90 rural and northern communities across Northern Ontario that very much support the learning of our medical students, and that are an important collaboration for the school. So to date, there's been some really early evidence that NASM is successfully graduating health professionals and future physicians who have the skills and desire to practice in rural and northern communities, and that NASM is having a largely positive socioeconomic impact on Northern Ontario. And these are just some of the studies that have been published to date that speak to how NASM's education has been associated with increased likelihood of practicing in rural settings and in Northern Ontario as well. But more recently, some have been asking, is Northern Ontario School of Medicine there yet? And so we're really hoping that today's presentation and this study will contribute to the body of literature, but also to the evidence around the ways in which NASM is having an impact on Northern Ontario. So this research project examined the experiences of NASM graduates, really to understand the impact of NASM's curriculum on practicing physicians. It explored topics like the choices they've made, how prepared and satisfied they are with their practice, and then any challenges they've faced in their careers to date. It was part of a longer tracking study, which was tracking graduates, but this was a qualitative study, really asking and trying to learn from those that have been through the NASM program to understand their experiences and about the NASM curriculum and the NASM learning model. As I said earlier, it was a qualitative research study. So we conducted, our primary data collection was through semi-structured interviews. We conducted 28 in total, and it was really the first 4 cohorts of NASM graduates. It was graduates who had completed a family medicine residency, and they had been practicing in Northern Ontario for over a year. The interviews themselves, the questions focused on practice decision-making, scope of practice, the impact of the NASM curriculum and specific elements of the curriculum, perceived competence, future practice intentions, and then there were a few questions about any adversity and coping and challenges about practicing in the North. Data analysis consisted of we transcribed all the transcripts verbatim. And then we conducted both deductive and inductive analysis. So a coding matrix was established when the interview guide was drafted. And so we used that in the analysis, but also allowed for inductive analysis. So different themes to emerge also from the transcripts. We used a 3 C's approach, so coding to categories to concepts. And really that method is about allowing emergent codes to present themselves, categorizing those codes, and then identifying the core concepts highlighted in that data. We ensured trustworthiness by a number of ways. One was we had 2 independent researchers who completed the analysis, all 28 interviews. We checked inter-rater reliability between the coders after the first 10 interviews had been completed, and then again after the 28 had been completed. We verified the identified themes with a 3rd researcher, and there was constant debriefing with the research team. And then we also conducted an expert audit at the completion of our analysis. So to move on to the results, these are some of the demographics of who participate in this study. So you can see the breakdown of the social life of the participants as well as the gender. And noteworthy that of those that we spoke to, 93% of the participants had grown up in Northern Ontario, and the remainder had grown up in Southern Ontario. So it just speaks to who we spoke to. So there were 3 major themes to emerge from the data from the study, and I'm going to speak to each theme and then have some concluding remarks. So really theme 1 was about how the curriculum supported and pushed students to learn and to form an identity across their medical training. Topics or kind of categories that participants spoke to were really about there wasn't really one core element of the curriculum. It was the continuity of care. So having exposure to patients throughout their training. The self-directed learning was a part of both their personhood building, but also their identity formation. The community exposure, so that longitudinal exposure. The small group learning really facilitated competencies around adaptiveness as well as resourcefulness. And the flexibility allowed space for very unique identity formation. And so one of the main things that came out is really that there wasn't one particular component or element of the NOSM curriculum. Really, it was the entirety of the NOSM curriculum in the undergraduate program specifically that allowed the flexibility, autonomy, self-directedness, and personhood building that supported students to build and explore key ideas and philosophies and skills that they celebrated and were contributing to their current practice. And that really it also pushed them beyond the familiar. So there was discussion of and comments about how participants felt that it was hard at the time, but that it really helped them to grow as learners and to be prepared for practicing in Northern Ontario. And here's just a quote, and I'm just going to read the last line of this quote from one of the participants. Did I miss anything? And being able to direct yourself to find that information and find resources is something that they taught us very well. So how to be a good doctor in uncertain conditions. So this participant was just talking about having the ability to be able to go into the literature, to be able to direct your learning and lifelong learning, to find core information, to really, again, always be learning and being adaptable to uncertain conditions that may arise in a Northern practice. Theme 2 that emerged in this study was around how NOSM curriculum really instills a more holistic patient view. So participants talked about the longitudinal curriculum and around the from day one in terms of the engagement with patients and exposure to patients and communities and working with community organizations onwards into at the end of their medical training. And really, it allowed them to develop a more holistic view of patients within clinical care and help them to really understand the lived realities of the social determinants of health in the North. And so really, it was that longitudinal patient exposure. So not just one exposure or one element of the curriculum, but that longitudinal, consistent presence of engaging with the patient population and seeing healthcare in action that really helped support the participants in terms of understanding patients' lived realities in the Northern Ontario and help them to prepare and gain the skills related to treating both the patient and the person that lives in and is from Northern Ontario. So not just one element, but very much across the curriculum, that constant longitudinal element was something that participants spoke to frequently. And here's just, again, 2 representative quotes, and I'll just read the one on the left. It's the exposure that NOSM provides in terms of learning regarding Francophone and Aboriginal just sets the path up for making that much easier to continue caring for those patients in practice. I think those skills and understanding that are imparted and learned during the training period in terms of cultural understanding, it's quite a seamless transition. So it really helped participants feel ready to go into practice in the North. And lastly, theme 3 was really about that NOSM graduates and those who go on to practice in the North are really feeling connected because NOSM in and of itself is creating a community of graduates in the North. So they feel connected. Not only were they met some great mentors, and established really strong collaborations with all of their longitudinal connections in organizations and with community, but those connections really continued on into practice. And so very much spoke about the importance of that peer mentorship group or the colleague group, and that sense of belonging and not feeling isolated in practice, but feeling connected to the NOSM community. So that really creating a community of graduates who go on to practice, who are connected with a sense of that community, agency and belonging, and feeling part of NOSM was a really strong theme that had emerged within the study. And so I'll just read again the one on the left. Like I work with 2 other physicians who help me if there's any concerns. So you get to know all the physicians, and having that sort of personal level makes it a lot easier as well too. So that's one sort of benefit, I think, that's all on the flip side of having the scant resources, just having that personal connection to other physicians. So where a lot of the graduates talked about having that ongoing, continued, and also very one-on-one learning environment at NOSM and in Northern Ontario, really that paying off in the long run. So just in conclusion, the 3 big takeaways were really the study is contributing to really trying to understand the impact of NOSM and the curriculum and how it's playing out in graduates' practice and their sense of readiness and preparedness for practice. It also speaks to how NOSM is influencing both the collective and individual processes and also identity development in Northern Ontario and how it's developing across the curriculum and the continuum of learning. And that really the community of graduates created through the medical training, both in undergraduate medical education and postgraduate medical education, is having an effect on encouraging physician recruitment and fostering important, long-lasting peer relationships and mentoring and really a sense of community. So that's all for this study. If you have any further thoughts or comments and that you would like to link, share with us and share with this kind of ongoing work, I'd be more than happy to connect and to answer any questions. So thank you for listening today, and hope you have a great day.